Good afternoon, everyone, and thank you for joining us today for this Medicare webinar series. And today's topic, Medicare options with Medigap and Medicare Advantage plans, presented by the Pikes Peak Area Agency on Aging. We want to thank Park County Extension, Park County Senior Coalition, the Seniors Alliance of Platte Canyon, and our hosts for their support of this webinar series. Before we begin, we ask that you please mute your microphones until we reach the question and answer portions of the presentation, or use the raise hand function to let us know you have a question, or you can also place it into the chat. And now it's my pleasure to introduce our presenter, Roma Costanza, State Health Insurance Program Coordinator and Case Manager at the Pikes Peak Area Agency on Aging.
Thank you, Jared. Good afternoon, everyone. Hope everybody's enjoying this wonderful, beautiful day. Welcome to springtime in Colorado. Thank you for joining us this afternoon. Today is part 2 of our 4-part Medicare 101 series. And today we're going to talk specifically about Medicare Advantage plans and Medigap, or Medicare Supplement Insurance. Hopefully everybody has their handouts for this presentation that I'm going to be referencing throughout. As Jared mentioned, I will pause throughout the presentation to see if anybody has questions. When I do pause to take questions, you're welcome to simply unmute and ask your question, or you can raise your hand, or you can type your question into the chat box at any time, and I will address those questions at the breaks. So let's go ahead and get started. So again, I am with the Pikes Peak Area Agency on Aging through the Pikes Peak Area Council of Governments here in Colorado Springs. The mission of the Area Agency on Aging is to work with our partner governments to develop comprehensive programs that allow people to stay in their homes for as long as possible. The Area Agency on Aging here in Colorado Springs covers a total of 3 counties, El Paso, Park, and Teller in Colorado. Again, this is in partnership with the Park County Extension Office, the Park County Senior Coalition, and the Park County Senior Alliance, and we appreciate those partnerships. And I am with the SHIP program. I am the coordinator for the SHIP program. The SHIP program, which stands for State Health Insurance Program, is a federally funded program that provides unbiased information and education on all things Medicare and all things possibly related to Medicare. This is a free program. We never charge for our services. Every county in every state should have access to a SHIP program, if nothing else, by a statewide toll-free number. The SHIP office here in Colorado Springs that I coordinate for is serving a total of 9 counties in Colorado. I've provided both our local Colorado Springs number and our Colorado statewide toll-free number. Anybody who calls the toll-free number will be routed to the SHIP office closest to where they're calling from. Quick review of what we discussed last week when we covered Medicare eligibility and benefits. We covered eligibility and enrollment into Medicare, both A and B. We covered what those benefits provide and what the costs are associated with those benefits. Medicare A and B are also known as your original Medicare benefits. So tonight we're going to talk about other kinds of insurance that you can enroll in to go with your original Medicare benefits. So now that you have Medicare, what else should you or could you do? There are 2 primary kinds of insurance that we're going to talk about. These are insurance plans or policies that you can purchase. Anybody with Medicare can purchase anywhere in the country. They are Medicare supplements, also known as Medigap insurance, or Medicare Advantage plans, sometimes referred to as Medicare Part C. Again, these are available to anybody who is enrolled in Original A and B of Medicare. Both of these insurance options are regulated by Medicare, and there are limited opportunities or enrollment periods when you can enroll in these benefits. We are going to talk about Medigap, or Medicare Supplement, first. I've been doing this a really long time. Medicare Supplement is the term I tend to use because that's the original language. Medigap is the newer terminology for this kind of coverage, and the thought process behind that terminology is that it covers the gaps in your Medicare benefits, your original Medicare coverage. Medigap insurance is a private insurance policy that you purchase from a private insurance company, and it is solely and specifically designed to pay the balance that Medicare left over after Medicare paid their part first under Part A or Part B benefits, period. I'm going to say that again. Medicare supplement insurance is a private policy you purchase from a private insurance company, and it is solely and specifically designed to pay the balance that Medicare left over after Medicare Part A or Medicare Part B paid their part first, period. These policies do have to follow all federal and state laws that are designed to protect you. They are regulated by the federal government, by Medicare. When you purchase this kind of insurance, you actually receive a hard copy policy, and on that policy, it must say Medicare Supplement Insurance, those 3 words in that order. For Medicare Supplement Insurance, there are levels of coverage you can choose to purchase. Those levels are standardized and they're labeled A through N like the alphabet, except for the 3 states listed where they have an additional option or 2. The cost for this kind of coverage can vary by any number of factors, but primarily the cost is going to be determined by the plan level that you choose to purchase, the company that you purchase it from, the zip code that you live in, amongst other factors such as whether you're male or female, etc. And we're going to talk about a lot of that in more detail. So how these policies work, or how these plans work. They only work with original Medicare. So when you are purchasing a Medigap policy, you are purchasing a policy that is going to be secondary to your original A and B of Medicare. There are some situations where you would not need to purchase this kind of coverage or want to purchase this kind of coverage. For example, if you are already enrolled in a Medicare Advantage plan, you could not enroll in a Medicare Supplement or Medigap. In the Medicare world, you can only have one or the other. You can't have both. If you have other creditable coverage, such as you're a retired military and have access to TRICARE for life, or if you have access to a retiree benefit, so, for example, if you're a retired para, retired federal civil service, even from a retired private employer, if they have offered you retirement health benefits that are coordinating with your Medicare, you may not need anything else. In this situation where you have original Medicare and a Medicare supplement or Medigap, because original Medicare is your primary insurance, A and B is your primary insurance, and a Medigap policy would be your secondary insurance, the rules of Medicare Part A and B reign supreme, and that means that you can go to any Medicare provider anywhere in this country for any medically necessary service, and Medicare A and B will pay their part, and whatever supplement you have will pay their part after the fact. So it is considered the most portable option, especially for people who tend to snowbird between here and another state, for people who tend to travel for extended periods of time. So it is considered the most portable and the least restrictive option or combination of coverage options. All right, so I will take a quick pause there to see if anybody has any questions about any of that so far. Again, if you have a question, simply unmute or raise your hand. All right, I don't see or hear any questions, so let's move on. So, who can buy a supplement or Medigap? Again, pretty much anybody who has Medicare Part A and B is able to potentially purchase a Medigap policy. Medigap policies also come with a limited period of what is called guarantee issue, meaning there's a limited opportunity where it's a better time frame to purchase this kind of coverage, and we'll talk about why in just a moment. In the state of Colorado, Medigap policies are also required to be sold to people who are on Medicare who are under age 65. So primarily that would be people who have been determined to be disabled by Social Security and have received at least 24 Social Security disability payments. After 24 payments, you automatically become eligible for Medicare at any age based on that disability. Not every state will allow or require companies to sell Medigap policies to people under 65 when they become eligible. Colorado does require it. However, keep in mind that if you are under 65 and becoming eligible for Medicare, these kinds of policies are more expensive because you are under age 65. But on the plus side, if you, whether or not you take advantage of getting this kind of coverage under age 65, when you turn 65, you get another opportunity to get this kind of coverage where the price actually goes down. So technically, you can purchase this kind of coverage at any time. There is no annual enrollment period for this kind of coverage. The reason that is because this kind of coverage, when you first become eligible for Medicare, the government requires that the insurance companies that sell this coverage, it requires that they sell you any level of coverage from any company you want with no questions asked. That's called guarantee issue. And you have a total of 6 months from the day your Medicare A and B go into effect, and it has to be both A and B. So if you're in a situation where you enrolled in A year ago, kept working, and are retired now and just getting Part B, this guarantee issue period doesn't start until both A and B are in effect. So when your Part B kicks in, that's when this guarantee issue period starts. The guarantee issue period lasts for 6 months from the time you have both A and B in effect. And what this guarantee issue period means is that when you go to enroll in this kind of insurance, you purchase this kind of insurance policy, the insurance companies cannot underwrite, meaning they cannot look at your health history. And if they don't like what they see, they cannot turn you down. You're guaranteed to be able to purchase any plan from any company you choose without question. Once this 6 months of guarantee issue expires, though, if you go to try and enroll in a plan for the first time, or you want to enroll in a different plan or with a different company, you would be subject to underwriting, meaning the companies can ask medical questions, they will look at your health history, and if they do not like what they see, they do not have to sell you coverage. Once that 6-month guarantee issue window, the clock starts ticking, you can't stop it. So it's a kind of an all or nothing deal. There are other opportunities that might come along down the road where you might have the ability to have what's called a special enrollment period, which would be a smaller or shorter window of guarantee issue into this kind of coverage. But again, this kind of insurance does not have annual enrollment periods. The bottom line is once you're in with a plan or a policy, you're in. But once you're out, if you have pre-existing health issues, you could be out and not be able to get this kind of coverage again in the future, with some exceptions that we are going to talk about. So some people might wonder, how would they or why would they be allowed to underwrite? With the passing of the Affordable Care Act, or otherwise known as Obamacare by some, that pretty much eliminated underwriting by insurance companies for most people. It did not affect this kind of insurance. So these companies are still allowed to underwrite people who apply for these policies in most situations. And that is because this kind of insurance does provide you that 6-month window of guarantee issue where they can't underwrite if you choose to purchase it within that window. But again, if you miss this initial 6-month window of opportunity to get into this kind of coverage, you may fall under other opportunities in the future where you would get a shorter window of opportunity to have guarantee issue into this kind of insurance. Other opportunities that might apply, depending on your situation, would be if you have Medicare and other insurance, such as a retirement health benefit that coordinates with Medicare, or you have employer coverage, or you're covered by your spouse's employer coverage, and that coverage ends through no fault of your own, otherwise known as involuntary loss of other creditable coverage. Anytime you have a loss of other coverage, Medicare will always give you an opportunity to get something else without question. So it's called a guarantee, a special enrollment period into guarantee issue. The other way you can get another opportunity into a Medicare supplement without underwriting typically involves enrollment into a Medicare Advantage plan. I'm not going to go into too much detail because we are going to cover that extensively when we get to the next section of this presentation that talks about Advantage plans. But there are a couple ways that if you have an Advantage plan and you lose that plan, you could have guarantee into a supplement. Just like with Medicare, there are some things that Medigap insurance will not pay for, and it's going to be the same things Medicare does not pay for. Because again, this kind of insurance will only pay the balance that Medicare left over after Medicare paid their part first. That's all it does. If Medicare denies a claim or a service, the supplement will not pay for it either, because it's not being left over by Medicare. So if Medicare doesn't pay for it, the supplement doesn't pay for it. If it's not a benefit of Medicare, it's not a benefit of the supplement. So things such as long-term care, vision and dental, private duty nursing, prescription outpatient drugs, all of those things not covered by your original A and B of Medicare are also not covered by the supplement. In your packet of handouts or in the email that I would have sent you that included the handouts, I included two separate handouts regarding Medicare supplement or Medigap. This first handout is a chart that details the different levels of coverage you can choose from when you are purchasing a Medicare supplement or Medigap policy. And I want to go over this chart real quick so that you understand what you're looking at here. So basically, again, Medigap policies come in different levels of coverage. Those levels of coverage are labeled plans, not to be confused with Medicare parts. So Medicare has parts A and B, supplements have plans. The plans are labeled A through N. Honestly, it used to be A through J, just like the alphabet, but several years ago, they took out 3 of the plan levels and replaced them with 3 others. And instead of just relabeling them A through J, they took out H, I, and J and replaced it with K, L, and M, or L, M, and N. So there's a gap in the alphabet there, but you get the point. What you're looking at on this chart is basically what benefits these plan levels pay after Medicare A or B paid their part first. So for example, under each plan letter, there's a list straight down under that of benefits. So if we look at this chart and we look at Plan A, for example, under Plan A, it says basic benefits, including 100% of the Part B coinsurance. What that means is if you purchase a supplement Plan A, it will only cover the 20% that Medicare left over for Part B services. That's it. If we go to Plan B supplement, it covers basic benefits, but it also covers the Part A hospital deductible. So if you purchase a supplement Plan B, it covers the 20% for Part B services after Medicare pays first, and it covers your inpatient hospital deductible, $1,600 this year, again, every time you're admitted. I'm going to jump over to Plan D as in dog. Plan D covers basic benefits. It covers your hospital deductible every time you're admitted. It covers your skilled nursing facility coinsurance. If you remember from last week, if you are admitted to a skilled facility after a 3-day hospitalization, Medicare pays 100% for the first 20 days of that skilled facility stay. From day 21 up to day 100, Medicare continues to pay for that skilled facility stay, everything except for $200 per day this year. If you have a Plan D or higher that includes skilled facility coinsurance, that means that plan pays that $200 per day that Medicare did not. Also under Part D, the very last benefit says foreign travel emergency. And I'll talk about that in a minute. Again, I'm going to skip over Plan F and go to Plan G as in goat. Plan G covers basic benefits, the 20% for Part B services, covers skilled facility coinsurance, covers your hospital deductible every time you're admitted, has an additional benefit called Part B excess. Part B excess is a terminology used because there are basically two different kinds of doctors, or two different ways doctors can take Medicare. And the way that's officially terminology, the official terminology for that is whether or not a doctor accepts Medicare assignment or does not accept Medicare assignment. And so let me explain this real quick. When you have original Medicare and you need to go to a doctor's appointment, just a regular primary care visit, in a situation where that doctor takes or accepts Medicare assignment, the way that works is, so you have an appointment to see your primary doctor. That doctor would charge anybody walking off the street with no insurance whatsoever. That doctor would charge $300 for that appointment. But you have Medicare and that doctor accepts Medicare assignment. So that doctor for that appointment is going to bill Medicare his regular rate of $300 for that visit, knowing that Medicare, when they get his claim, is going to turn around and reduce that $300 to $100. That's what Medicare values that appointment at. So Medicare is going to take the $300, cut it down to $100. Medicare pays 80% of what they allow for any service under Part B. So Medicare pays 80% of the $100, pays that directly to the doctor. If you have a supplement that includes Part B excess benefit, or not, any Part B benefit, basic benefit, the supplement pays the other 20% of that $100. The doctor gets paid a total of $100. That doctor accepts Medicare assignment, meaning that doctor accepts whatever dollar amount Medicare assigned for any service they provide as payment in full. So even though the doctor billed Medicare $100, he knew Medicare would reduce it to $100, and that's what he would get paid. And they're okay with that. They accept Medicare assignment. The other way a doctor can accept Medicare or participate with Medicare is by not accepting assignment. Basically works the same way. You go to a doctor for a regular visit. That doctor is going to bill Medicare $300. Medicare is still going to turn around and assign $100, pay 80% of that. When a doctor does not accept assignment, however, that doctor is allowed to charge you upfront 15% more than what Medicare assigns for his service. Medicare already has a predetermined dollar amount for any and every service you could ever get. So the providers can look that amount up, calculate 15% above that, and ask you to pay $115 before you leave the office. Because that doctor does not accept assignment, he is allowed to ask you for payment up front. When that doctor bills Medicare, Medicare is going to see that that doctor does not accept assignment, and Medicare is going to assume you've already paid the doctor up front. So when Medicare gets the claim, reduces it to $100, pays 80%, Medicare is going to send you a check for $80. The balance of $20 goes to the supplement. Supplement's going to send you a check for $20. That extra $15 that you paid up front, or 15%, is called Part B excess, which is the benefit under Part G. If you have a plan that includes that Part B excess benefit, not only will the supplement pay you the 20%, but they will also pay you that extra 15% you paid up front. So you'll get all of your money back if you have a supplement that includes that benefit and you go to a doctor that does not take assignment. When a doctor accepts assignment, Medicare bills that or pays that doctor directly. The supplement pays the doctor directly. But when a doctor does not accept assignment, they're going to ask you to pay up front. And that's usually the easiest and quickest way to tell if a doctor does not take assignment. If you call up a doctor's office and ask them if they take assignment, they'll probably have no idea what you're talking about. But if you ask them, do I have to pay up front, or do you bill Medicare and depend on them to pay you? That's usually the easiest way to find out. Honestly, most providers, most outpatient providers do take assignment nationwide, but there are enough of them out there that do not take assignment. And the reason Medicare allows them to do that is kind of an enticement to encourage doctors to participate with Medicare by allowing them to make that extra 15% income. Plan G also has foreign travel emergency benefit. When we get to plans K and L cover the 20% that Part B left over for basic services, but they only pay it at 50 or 75%. So instead of the basic benefit covering the whole 20% balance that Medicare left over, Plan K only pays that at 50%, Plan L pays that at 75%. Same for skilled nursing coinsurance, same for the inpatient hospital deductible. Because those plans pay less than 100% after Medicare for the balance that Medicare left over, those plans are obviously going to be less expensive. And they do have maximum out-of-pocket limits, meaning after Medicare pays their part, the supplement pays their part, and you still have to pay that 50 or 25% left over. If you spend out of your pocket in those percentages, $6,940 for the Plan K or $3,470 for the Plan L, that would be the most you'd pay out of pocket after insurance and Medicare under those plans. The likelihood of you spending that much money, even in a really bad year, because you're only paying 50% of the 20% or 25% of the 20%, it takes a long time to add up. So they are cheaper, but may not be as cost effective as they should be. Plan M, as in Mary, pays 100% for the Part B coinsurance, pays 100% for skilled facility coinsurance, only pays 50% for your hospital deductible. Does include foreign travel emergency. Plan N, is in Nancy, the very last plan, pays 100% for Part B services, except for 2 services. It pays 100% after Part B for everything except for regular office visits of any kind, specialist or primary, or ER visits. If you have a office visit, they're going to pay everything except for $20. If you have an emergency room visit, they'll pay everything after Medicare except for $50. But it does pay 100% for the skilled facility coinsurance, pays 100% of your hospital deductible every time you're admitted, has the foreign travel emergency benefit. What I can tell you based on this chart is that Plan G is basically going to be considered the Cadillac level of coverage because it provides the most benefit. Plan N is becoming fairly popular. It's a lower premium plan that basically provides the same benefits without any bells or whistles. None of these plans offer prescription coverage, dental, vision, or anything like that. They only cover the basics because they only cover what Medicare A or B left over. The foreign travel emergency benefit that some of these levels have, the way that works is if you are out of the country in a foreign country and you have a medical emergency, pay for that emergency while you're in the foreign country. But when you got back home, you could submit that bill or that receipt for that medical emergency to your supplement. Supplement would turn around and say, you need to bill Medicare for a denial. So then you go and bill Medicare for a denial of those services because they're not going to pay you or out of the country. You get that denial, you submit that denial with the bill for your medical emergency in a foreign country, and the supplement will reimburse you 80% of that emergency after a $250 deductible. So it's not actual insurance, but it could be some cost reimbursement if you have a medical emergency in a foreign country. It is not travel insurance, but it is reimbursement in that specific situation. If you do plan on traveling out of the country, I always encourage people to look at purchasing travel insurance because it would be worth it. Usually you'd want to buy travel insurance that pays at the time of need and not travel insurance that you would have to do the same thing, submit receipts, and get reimbursed. All right. Any questions about any of that? I know it's a lot of information, but it'll make more sense here after a minute. So that is the levels of coverage you have to choose from if you are looking to purchase a Medicare supplement plan to go with your original A and B. Again, Plan G is going to be considered the Cadillac. Because it is considered the Cadillac, it is one of the most popular plans sold, which means the price is relatively, it's going to be lower. It's not going to be the highest priced plan because they sell a lot of them. The other handout that I provided that was either in your packet or that I sent you via email is a multi-page handout. It says Medicare Supplement Policies in Colorado, dated September of 2022. This is the most current document. This is a document that is put together by the Division of Insurance up in Denver, and we are very, very fortunate that they take the time and energy to do this for us because not every state does. What this document is going to tell you in the first half is going to give you a brief couple of paragraphs or overview of everything I've already talked about. Guarantee issue, your 6 months of guarantee issue. It's going to talk about turning 65, all that kind of stuff. But then it's going to go into these charts. And what these charts are going to show you is a list of all the companies that are licensed to sell this kind of insurance in the state of Colorado. There are over 40 of them. So the companies are going to be listed along the side of the page in alphabetical order. It's going to say A through N across the top of the page, just like the chart we just looked at. So that represents the A through N plan levels. If you go down the list of companies and you say pick company X, and you go to the right and you say you're looking at a plan G, if you go to plan G, you scroll down till you get to where the company X and the plan G meet on that chart. If there's a number in the box where those two things meet, that number does represent an approximate monthly premium for that plan with that company. I say approximate. They're not going to be specific price quotes. They're going to be in the ballpark. If there is no number in a box where a plan and a company meet, that means that company does not sell that plan level. So you'll notice even on this chart, there are a lot of empty boxes, but every box is filled under plan A. Every box is filled under plan G, except for one or two, and most boxes are filled under plan N. Again, those are G and N are going to be the most popular plans sold. Plan A is the only plan the state actually requires these companies to sell. That's why all those boxes are filled. But if you go down the list, say you're under plan G and you're going down the line, you'll notice that the numbers in these boxes can vary from company to company quite significantly. The most important thing to remember about Medicare supplement plans is that they are set in stone. This chart, the plans outlined on this chart are set in stone. They are standardized, which means no company can change these plans in any way. Every company that sells these plans is selling you the exact same plans. Plan G is a plan G is a plan G, no matter who you buy it from. They are set in stone. What that means is, even though prices for a plan G can vary quite a bit from company to company on this list, they're all selling you the same thing, the exact same product. So it does pay to shop around. There is absolutely no advantage to paying a higher premium for a plan G when you can get it for a lower premium from another company. You're not gaining anything by paying more. They're all selling you the exact same thing. They cannot add to these plans. They cannot subtract from them or alter them in any way. So keep that in mind. It does pay to shop around. You'll also notice that this chart is divided by male versus female. Honestly, women tend to pay lower premiums for this kind of coverage because statistically we take better care of ourselves. So you will notice that many companies have slightly lower premiums for female. Other factors that could factor into how companies determine premiums, there's a whole myriad range of them, from age to smoking to non-smoking to zip code to, you name it. They can factor in all kinds of different things. There is also a notes section between the plans and the company names that have little symbols in them. There is a keynote page just prior to where these charts start that will tell you what each one of those letter designations mean. Many companies are really starting, unfortunately, to charge an application fee. I don't agree with that. I don't know why they get away with that. I don't see any reason you should have to pay an application fee to apply for this kind of insurance, but do keep that in mind when you're looking at these companies. Some of these companies may provide household discounts, meaning if a husband and wife or a married couple both buy a plan from the same company, they may get a discount. Some of these companies may offer discounts if you pay annually instead of monthly, if you pay monthly instead of annually. So those are other things that you might want to ask about. Because all of these companies sell the same products, they are all required to pay based on your level of coverage that you choose per federal guidelines. I get a lot of people who ask me what's the best company to go with. And honestly, there isn't one. These companies, based on the plan that you choose to purchase, will do exactly what they're designed to do. If Medicare pays first, the company will pay benefits after Medicare based on your plan level, period. They cannot deny a claim if Medicare paid their part first. Everything is done electronically. So doctor bills Medicare, Medicare processes their part, Medicare bills the supplement. And everything is done electronically, so it's all automatic. So honestly, there is no one company better than another. If that is something you really, really wanted to factor in on your decision making, in the pages in this handout prior to these charts, there is also a list of the financial rating websites, the S&P, the AM Best, where you can look at the financial histories of these companies if that's something you want to factor into a decision. However, I honestly don't believe there's any really such thing as financial stability these days in many situations. So just because a company has been financially stable does not mean it always will be. The bottom line is, when it comes to this kind of insurance, if you enroll in company X with a Medicare supplement, and 5 years from now, company X goes out of business, and you lose that policy, you will always, always be guaranteed into something else, because that would be considered involuntary loss of coverage. And Medicare will make sure that you have an opportunity to get into something else with guarantee issue because you lost your coverage through no fault of your own. So you will never be in a situation where you are uninsured and uninsurable through no fault of your own, because Medicare will make sure you have an opportunity to get something else. So it really does pay to shop around. It pays to look at prices. On this list, again, at the top of this page, you'll notice in little tiny letters, it says up here, age 65. Each page, front and back, will have a different age designation. The companies that are licensed to sell this coverage in Colorado are listed on these pages, front to back, in alphabetical order. So the first page will say age 65, the next page will go to age 70, the next page will go to 75, and so forth, up to age 80, and then it will go to under 65. Once you've reached age 80, the prices stop changing or going up. Obviously, the older you are when you go to purchase this kind of coverage, the more expensive it is going to be to start. So the best price that you're ever going to get is when you are just turning 65 and you're buying this coverage within the first 6 months during your guarantee issue period. All right. Any questions about any of that? I know that was a lot of information.
We have a question in Bailey.
Absolutely.
Is it safe to assume that just because this is Medigap doesn't mean that a doctor is going to accept this insurance just like they don't accept all health insurance already?
No. If a doctor accepts your Medicare A and B coverage, because with this insurance, A and B would be primary, supplement would be secondary. If a doctor accepts original A and B as your primary insurance, they have no choice. They have to accept your supplement, no matter who it's with or what it is. They cannot just
Thank you.
say, I'll take your Medicare, but not your supplement. They cannot do that.
Thank you.
Yep. Any other questions?
And yeah, here in Guffey, the zip code, is that what you guys want to know? The zip, huh?
Yeah.
The zip code, is that comparable to where we actually are at, since it's a different zip code than Guffey?
So again, this handout is not designed to provide exact price quotes, but
Okay,
it's gonna give you pricing in the ballpark. Because the premiums can vary with these companies from zip code to zip code. If you look at this handout, the zip code this information was based on was 80202, which is a Denver zip code. They tend to pay slightly higher premiums than most of the other rest of the state. But if you look at the premium, say for the AARP at the very first listing, the price difference between what's listed for that zip code and what you might pay in your zip code might be $10 or $15 at the most in difference.
Okay, how do
So
we
that-
find it?
is there a
It's
way
got-
to find out?
Well, honestly, the most effective way would be to call an individual company and ask them exactly what their pricing is for you right now. Because this handout is put out in the summer or late summer every year by the Division of Insurance, but companies do tend to raise premiums at the beginning of each year. So it's always best to call them and ask them directly. However, if you are interested, you can call our office and talk to a SHIP counselor. And we have just recently gotten access to a search engine that is supposed to be updated on a daily basis that we can get more specific, more accurate price quotes for any of these companies.
You could just call them.
Yeah,
Yeah.
my other question is,
Another question too.
Sure.
where are the notes explained? She said something about it, but I don't see them.
Notes for what?
So
After
under the
company
notes,
name,
yeah.
There are notes.
Yeah,
So there should
where
be
is
a
that?
note key
Find out.
page just prior to where these charts start, should be the previous page.
oh, that, yeah,
No, I didn't-
the one that looks like that.
Oh, there it is.
Yeah, okay, we
Okay.
found
Then
them.
get policies and prices.
Yeah,
Okay, I get it.
thank you so
I
much.
was
Got it.
looking at the med.
You're welcome.
benefits. It's not-
Anything else, guys?
Any other questions from anybody? Comments? All right. All right, so that is Medicare supplements or Medigap in a nutshell. I did have another thought that I was going to mention. So again, keep in mind, I would just want to reiterate this, there is no annual enrollment period for this kind of coverage. The best time to get it, especially if you have any sort of pre-existing health issue of any kind, is when you first become eligible for Medicare during that 6-month window of guarantee issue, where they cannot turn you down regardless of health. Once that 6-month window expires, if you go to purchase this kind of coverage for the first time, if you want to look at purchasing a different policy from a different company because you found something cheaper, keep in mind you would be subject to underwriting based solely on questions they ask in the application. And if they do not like the answers to those questions, they will not sell you coverage. So once you have a pre-existing health issue of any kind, it becomes much more difficult to purchase this kind of coverage outside of guarantee issue. If you are healthy and can pass underwriting, and they don't mind the answers to those questions on the application, you can switch companies or plan levels as often as you like. Every month if you want, because you're healthy enough to pass underwriting. But it's once you develop any sort of health issue that it becomes a little more problematic. So just keep that in mind. No annual enrollment period for this coverage. Also, if you have original Medicare and you get this kind of coverage, keep in mind it does not come with drug benefits. So you would have to look at purchasing a Medicare Part D plan in addition to this coverage with Medicare. And we'll talk about that in more detail.
I have a quick question, Bailey, then. If you
Sure.
do decide to switch, thinking you can pass the underwriting, and then you don't pass the underwriting and you're denied by those people,
Does that go into a database where your previous insurance or any other insurance can see that?
No, not at
Okay.
all. And you certainly would not want to cancel any current coverage you have until you have that yes or no answer from another company, if there's any question about it. So just in case they did say no, at least you haven't dropped your existing coverage. But no, nobody keeps track of that. Once the applications are approved or denied, that stays internally with that company, and it is not shared. Any other questions? All right. So again, that's supplements in a nutshell. Again, you're always welcome to call us and talk to one of the SHIP counselors. If you want more accurate price quotes for this kind of coverage, we can go into that database and get more current and more accurate pricing for you. So let's talk about the alternative, Medicare Advantage plans. Medicare Advantage plans, I'm sure you've heard of and been inundated by a barrage of TV commercials, junk mail in the mailbox, texts or emails in your electronic mail. These are the plans that are advertised relentlessly. But they are an entirely different animal than Medicare and a Medicare supplement. So when people have a Medicare Advantage plan, keep in mind that these are plans offered by private insurance companies, but these companies have contracted directly with Medicare. And the way that works is Medicare pays these companies a flat dollar amount for every person that these companies enroll in one of their plans. And that's how the plans get paid by Medicare to cover the services that you need. When you enroll in this kind of plan, you still have your original A and B of Medicare, but these plans, when you enroll in them, take over those benefits. They become the managers of your A and B benefits. So all services that are covered under A and B must go through the plan. You still have all of your Medicare rights and protections. These plans are still regulated at the federal and state level. You still get all and any Medicare covered service through these plans. These plans have to cover anything and everything original Medicare would pay for. But these plans are called Advantage plans for a reason, and that's because these plans do tend to come with a lot of bells and whistles. They come with, many of them or most of them will come with routine vision and hearing services, dental coverage, free gym memberships. As time has gone on, these plans have become allowed to offer more and more variety of extra benefits that would not normally be covered by your A and B of Medicare. And we'll talk about a little bit more of that about those as we go. These plans usually do come at no extra cost with prescription coverage, Medicare Part D. So there are advantages to these plans, but they're not for everybody. They come with a lot of bells and whistles for things that are not covered at this point by original Medicare. And that's why they are called Advantage plans. But keep in mind, they become your Medicare when you enroll in them. Additional limitations or requirements to enroll in an Advantage plan is you must live in a plan's service area. Where original Medicare is good everywhere in the country, and you purchase a Medigap policy in the state that you live in. With Advantage plans, you must live in the plan's service area that it's available in. And for all intents and purposes, that is going to be your county of residence. That is the service area. So Advantage plan options vary county by county. Again, you must have both A and B of Medicare to enroll in an Advantage plan. And Advantage plans do have eligibility periods or enrollment periods. And for Advantage plans and Part D plans, there are multiple enrollment periods to understand. So initial enrollment period is going to be the same time frame as enrolling in original Medicare. You get that 7-month window surrounding your birthday month turning 65, or your eligibility month, which is the 3 months prior to the month you turn 65, the month of, and up to 3 months after the month you turn 65. That is your initial enrollment period for an Advantage plan as well. Then there are annual enrollment periods for Advantage plans. There is the annual election period, or what we tend to refer to simply as open enrollment, that happens every fall between October 15th and December 7th. Then in 2018, Medicare decided to initiate an additional enrollment period just for Advantage plans called the Medicare Advantage Plan Annual Open Enrollment Period. And then, as always, in all things with Medicare, there are special opportunities that you might fall under to have additional timeframes where you can enroll in an Advantage plan, special enrollment periods. So again, annual election period or annual open enrollment, October 15th through December 7th. During that enrollment period, you can get into, you can get out of, or you can switch from one Advantage plan or Part D plan to another. You can do any of those three things during that period. Any change you make in that time frame goes into effect automatically January 1st. So that applies to both Advantage plans and standalone drug plans, Part D plans. The annual Medicare Advantage Plan open enrollment period that started in 2018 applies only to people who are enrolled in an Advantage plan as of January 1st each year. So if you enroll in an Advantage plan for the first time during the annual enrollment period or open enrollment period, as of January 1st, you're enrolled in an Advantage plan. Between January 1st and March 31st, you would have an additional opportunity to either switch to a different Advantage plan or drop Advantage plans and go back to original Medicare. If you make a change to do one of those two things anytime during those 3 months, any change you make goes into effect the first day of the next month. If you are not enrolled in an Advantage plan on January 1st of any year, this enrollment period has nothing to do with you. It does not affect you. It is only for people who are enrolled in an Advantage plan on January 1st. And again, it allows you to either switch to a different Advantage plan or drop Advantage plans and go back to original Medicare. And then special enrollment periods, they tend to be used more often with Advantage plans. And that is because, again, Advantage plans are limited to your service area or your county of residence. If you move from one county to another, you cannot take your Advantage plan with you. You have to leave it in the county you're moving from. Because you cannot take it with you, and that's through no fault of your own, it's still considered involuntary loss of coverage because it was through no fault of your own. In that scenario, you would have two options when you get to where you're going, when you move to whatever county you're moving to. You would either be able to enroll in an Advantage plan available in the county you're moving to, whatever's available there, or you would have a 60-day window to be guaranteed into a Medicare supplement when you get to the county you're going to. And that's whether you move to a different county or a different state. The bottom line is you move out of the county you live in. So you can either, when you get to where you're going, you can either enroll in another plan, Advantage plan available in that area, or have a 60-day window to be guaranteed into a Medigap policy. Very important to remember. The other way that could happen is if you're in an Advantage plan and that plan decides that they no longer want to be available in the county you live in. So the plan pulls out. Again, same thing, involuntary loss through no fault of your own. You'll have the opportunity to get into another plan available in that county or have a small window of guarantee issue into a Medigap. Also applies to any other involuntary loss of other creditable coverage, such as retirement benefits, etc. The other way you can take advantage of that with an Advantage plan is through what they call a test drive. Medicare Advantage plans are pretty new on the market, all things considered. When I first started doing this job 23 years ago, there was one Advantage plan, and they weren't called Advantage plans back then, but that was Pacific Air. Then it was known as Secure Horizons, and now it's known as AARP, Medicare Complete, whatever. In the last 5 years alone, Colorado has gone from a total of 5 Advantage plans to 27 Advantage plans in most counties. That is a huge, huge expansion of plan options in a very short amount of time. When you have such a large growth of plan options for something this complicated, there tends to be a lot of confusion. And unfortunately, many people become enrolled in this kind of coverage thinking that they were enrolling in something else altogether, or they become enrolled in this coverage through no knowledge of their own for whatever reason. Because there's so much confusion surrounding the plan options available to go with Medicare these days, Medicare saw that this was becoming an issue, people getting into these plans, not realizing what they were getting into, wanting back out. So they created what they call a test drive or a trial right. What that means is if you enroll in an Advantage plan when you first become eligible for Medicare, you decide you want to try the Advantage plan out first for whatever reason, you get into it when you first get Medicare. Medicare will give you up to 12 months to test drive this kind of coverage. If at any point within that 12 months you decide that that kind of coverage is not for you, you would be allowed to drop the coverage, the Advantage plan, even though it's not an enrollment period of any kind. You'd be able to drop that plan and still have guarantee issue into a Medicare supplement. So when you get this coverage, when you first get Medicare, it almost basically extends the 6 months of guarantee into a supplement into up to 12 months because you are in the Advantage plan first. If you get into that Advantage plan first and you are in it for more than 12 months, you lose the opportunity for that test drive and that guarantee into a supplement. The other way you can do that is if you get Medicare for the first time, you enroll in a Medicare supplement from the get-go. You have a supplement for 2, 3, 4, 5 years, however long, and then 1 year you just decide you want to try the Advantage plan. This would allow you to drop your supplement as long as you've maintained that coverage with no break since you got Medicare. You'd be allowed to drop your supplement, enroll in an Advantage plan during an annual enrollment period, and have a 12-month test drive opportunity to see if that kind of coverage is going to work better than your supplement. If you decide you like it, you stay with the Advantage plan. If you try to get back into the supplement, you'd be subject to underwriting. If you take advantage of the test drive in this way and you decide you don't like the Advantage plan, you can drop it at any time within that 12 months and be guaranteed back into the supplement you dropped. So there's 2 different ways you can do the test drive opportunity. Any questions about any of that? I know that can get a little confusing. Nope. Okay. So again, this kind of coverage is an entirely different animal than having Medicare with a supplement. Your out-of-pocket costs are slightly different than having Medicare and a supplement. When you enroll in an Advantage plan, you absolutely still have to pay your Part B premium. There's no getting out of that no matter what. You may have to pay an additional monthly premium to have the Advantage plan. However, having said that, I can tell you that most Advantage plans right now in Colorado, 0 premium. But there will be other out-of-pocket costs that you have to worry about in these plans. So how these plans work. Again, you will get any and all Medicare covered services, but you get them through this plan. Again, most Advantage plans will include prescription Part D coverage at no extra cost. So if you have a 0 premium Advantage plan and it includes drug coverage, it's still 0 premium. However, you may be limited to the providers and facilities that you can go to for care based on the plan. The plan will cover you in any situation, anywhere, with any provider in an emergency. But outside of emergency or urgent need, The plan may limit what providers and facilities you can use. And the cost sharing is going to be slightly different because for most services with these plans, you will pay a copay at the time of service. And just to make things a little bit more exciting, there are many different kinds of Advantage plans to choose from. You've got HMOs, PPOs, fee-for-service plans, special needs plans, and now we've got even one more wrench in the get-go. Some of these plans now come with a point of service option, just to make it a little more complicated. Other types of plans that we don't really have to deal with in Colorado at this point are Medicare savings accounts. There are no companies that sell those at this time in Colorado. We don't currently have any demonstration or pilot programs going on in Colorado, but we do have a PACE program, a program for all-inclusive care. And I'm going to talk very, very briefly about each one of those types of plans. If you want a complete list of all the plans available in all of Colorado, the best way to do that is, again, to get a Medicare and U handbook specific to Colorado, and it will list all of those plans in the back of that book based on the counties or the regions in Colorado. You can do that by going to the Medicare website or calling 1-800-MEDICARE. Or if you need one, I did actually get some cases of the Medicare and U handbooks this year from CMS, and I'd be happy to either bring one to you or provide somewhere where you can pick it up. They are rather heavy, so I tend not to like to mail them, but we will find a way to get you one if you need one sooner. If you ask one to be mailed to you, it can take 6 to 8 weeks to get. So let's talk about the different kinds of plans because they all work a little bit different from the other. So we'll start with HMOs, or health maintenance organizations. If you have ever had an HMO, whether it's through work or whatever, an HMO is an HMO is an HMO. They all work exactly the same way. You pay copays for every service. You have a network of providers and facilities you are required to use. And if you go out of that network, the plan will not pay for those services. In an HMO, you may be required to get referrals to see specialists or other types of doctors, or prior authorization for some services. Again, if you go out of network, the plan will not pay for those services. And in a Medicare HMO, if you go out of network, if your plan does not pay, Medicare will not pay. So if you go out of network, nobody's going to pay for that need. HMOs will 99% of the time come with Part D. PPOs, or preferred provider organizations, are a little more flexible. Preferred provider organizations have a network of providers and facilities they would prefer you use. And if you use that network of providers and facilities, you will pay lower copays. But PPOs allow you to go out of network. What that means is if you can find a doctor provider that will accept your PPO Advantage plan and accept your copay plus what the plan pays them, you can go to that provider. However, you're going to pay a higher copay to be out of network. It's your job to make sure the provider will accept that insurance. But because you're allowed to go out of network, and if you can find that provider, no referrals are typically going to be required to see other types of doctors. But you may still have to worry about prior authorization for some services. PPOs may or may not come with Part D. There are some PPOs out there that do not include Part D for people who may not need prescription drug coverage through Medicare, for example, if they have access to VA pharmacy. If you enroll in a PPO that does not include a drug benefit, you would not be allowed to buy a separate Part D. So you would have to have a reason you don't need Part D coverage. Again, example, you have access to the VA pharmacy. Medicare fee-for-service plans, private fee-for-service plans, are supposed to be the most flexible Advantage plans. Technically, they don't have a network of providers that you're limited to. You can go to any Medicare-approved provider or facility that is willing to accept your fee-for-service plan, your copay plus what they pay them, as payment in full. So there is no service area. You can go to any provider that you can find that's willing to accept that plan. Downside to that is that because there is no network, that means there are no providers that are contracted with your plan. So they can decide to take you as a patient with that coverage on a case-by-case or visit-by-visit basis. And just because they took you as a patient for one visit does not mean they have to take you for a patient as the next visit. But it is your responsibility to make sure whatever provider you want to see will accept your coverage. These kinds of plans also do not require referrals, but may still require authorization for some services. These kinds of plans may or may not come with Part D coverage included. If it does not come with Part D coverage included in the plan, you would be allowed to purchase a separate Part D coverage plan in addition to the fee-for-service plan so that you have drug coverage. But again, most providers are going to decide if they want to accept you with that coverage on a case-by-case basis. Special needs plans are basically going to be HMOs, Advantage plans, but for very specific population, and that's going to be people who are Medicare and Medicaid, or people who live in long-term care facilities, or people who have chronic qualifying health issues. Special needs plans are not available in every county of Colorado, but if that was something you wanted to look into, you could always give us a call or call 1-800 Medicare. Same with PACE programs, Program for All-Inclusive Care of the Elderly. It's basically a Medicare HMO Advantage plan, but it provides a little more intensive hands-on case management. Again, it's a program for a specific population of people who would be eligible for Medicare with long-term care Medicaid and qualify based on the Medicaid eligibility. But again, it provides more hands-on case management because this program is designed to allow people to be able to stay in their home longer versus having to go into a facility or assisted living. So it helps keep them at home and in the community longer because of that more hands-on management. Again, if you wanted more information about that program, PACE program is typically primarily available along the Front Range, the I-25 corridor at this time. So not really available in rural areas, more available in, say, Colorado Springs and the Denver area. So when you have an Advantage plan, you do have certain rights specific to Advantage plans, meaning you have the right to have access to whatever kind of healthcare provider you require. The plan is absolutely required to make sure that there is a provider that they will pay or that is in their network for whatever you need. You also have the right to know how those providers get paid. If you dispute something, you have the right to a fair, efficient, and timely appeal process or an expedited appeal process in some situations. You have the right to get any health service that you need. You have the right to get information about your plan in easy to understand language. And of course, you have the right to have all of your personal information kept private. Now, in the packet of handouts or the email that I sent, there is a handout specific to Advantage plans. There's two of them actually, but the one I'm talking about is the one that is multiple page, and it kind of gives you the same information that I just gave you. It gives you description of each type of plan. But the thing I like about the handout is that it also gives you some pros and cons about each type of plan. So it goes into a little more detail and a little better explanation of how these plans vary from each other and the pros and cons of each. Any questions about any of that? No questions at all? It's all clear as mud. We take a 10-second quiz, you're all going to pass it at 100%. All right, I won't do that because you can always call us if you have questions after the fact. All right, so no questions, we'll move on. Let's talk about marketing. Specifically, the marketing of Medicare Advantage plans and or Part D plans, but not so much as the Advantage plans. There are lots and lots of rules surrounding how these plans can be marketed to you. There are lots and lots and lots of things that insurance companies and agents cannot do when it comes to marketing this kind of coverage. Things to keep in mind is that agents, brokers, or representatives cannot approach you in common areas, parking lots, sidewalks, lobbies, hallways. They cannot send unsolicited texts or unsolicited phone calls, cold calls. Now, keep in mind, a cold call has become a little harder to define. A company can cold call you if you have ever, at any point in your life, had any sort of relationship with that company or its parent affiliates. So if you had insurance through an employer 20 years ago or 30 years ago, and that employer used company X, and you're still in their database somehow, and that company X sells a Medicare Advantage plan product of some sort, they can call you and solicit that product. It's not considered cold call. If you've never had a relationship of any kind with a company and they cold call you, that's not allowed. But that's why it gets a little gray, because who's going to remember 20 or 30 years ago? You can, if they do send emails, so they are allowed to send emails, unsolicited emails, but they must have an opt-out option or unsubscribe option in the email that you can take advantage of. And of course, they're always going to be allowed to send you junk mail through the mailbox. Representatives, agents, or brokers cannot ever use the term free to describe zero premium advantage plans or zero premium copay services. Free is not a word that they are allowed to use. They cannot require that you sign anything, even a sign-in sheet, to attend any sort of informational presentation. So if you see an advertisement or get an invitation from an insurance agent or representative to come and get a Medicare 101 or to come and, hear about whatever it is product that they sell, they cannot require that you sign in when you go to that event. They are not allowed to require you give them any information about yourself in order to attend any sort of information or education event. And they're not allowed to camp out, specifically in doctor's offices. So if there's a table, an insurance table with a specific company or product in that office, that's honestly a no-no. Doctors shouldn't be allowing them to do that either. Other things they cannot do is misrepresent themselves to a beneficiary by suggesting that they work for the government or work for Medicare, because again, these companies are not the government or Medicare. They're private insurers that have contracted with Medicare. They cannot conduct marketing for their products in the same space or not in the same space, but at the same time as an educational event. So some agents or brokers will advertise that they're going to do an educational event. They're going to give you Medicare 101. Same thing I'm doing, where they can only talk about general Medicare information. They're not allowed to talk about whatever it is they sell specifically. Or they can do a marketing event where they're just going to give you all the red, white, and blue and apple pie details of what they sell. In the past, those two things could not happen within 100 feet of each other or even 1,000 feet of each other. What can happen today is if a representative with a company is doing a Medicare 101 in room A, as soon as that 101 is done and people are leaving, they walk out the door of that room, they can have a marketing table right outside that door. And you can go up to that table and ask for information. But they would not be able to leave that table and come up to you to give you information. For me, this gets all very, very gray, and it's I think a little ambitious to expect you guys to be able to recognize some of this stuff. But I'm going to tell it to you anyways, just in case, because it's better to have this information. And again, you have the handouts you can refer back to than not. Things that they cannot do. they cannot provide meals. So they cannot buy you dinner. They cannot buy you lunch to attend a marketing event. But if you go to an event, they can provide light snacks, coffee and cookies, that kind of stuff. They cannot offer anything for free, any free items or services that would be worth more than $15. And that would be $15 per person, or if you attend multiple events that have free giveaways, you cannot have more free giveaways than $75 per year per person. And those giveaways would have to be provided to all attendees, regardless of whether or not that person enrolls in something. And most importantly, they cannot go door to door. If someone knocks on your door wanting to talk to you about a Medicare Advantage plan or Part D plan, that is a huge no-no. Also, they cannot leave flyers, brochures, or business cards at someone's door. Unfortunately, there have been incidents where agents or brokers have gotten into secured apartment complexes and just started going down the hallway knocking on doors. That is a big no-no. If you happen to come across any of these activities, please call us. Call 1-800-MEDICARE. Call the Division of Insurance. Call somebody and let them know. Because if you witness something or think you see something and you don't say something, that agent and broker is just going to keep getting away with things that they shouldn't be doing. So, things that they must do, these Advantage Plan and Part D plan companies must submit all of their marketing material to Medicare for approval before they start using it. That also includes their presentation material. They must, as far as that goes, apply with any do not call registry. They must obtain written permission to contact you, to sit down and talk to you about whatever products they are selling. And during that appointment that you schedule with them voluntarily, they must ask you to sign what's called a scope of appointment that outlines what they're allowed to talk to you during that appointment, which is whatever products specifically you contacted them for an appointment for. So for example, if you want to talk to an agent and schedule an appointment to talk to whatever Advantage plan that agent sells, during that appointment, that agent can only talk to you about Advantage plans. If that agent also sells other products such as Part D plans, annuities, life insurance, whatever, if you wanted to talk to that agent about any additional product, you would have to wait until the end of the appointment that you are in talking about Advantage plans. At the end of the appointment, they could have you sign another scope of appointment that says, now I want to talk about whatever other product it is you want to talk about. I did provide a handout that includes this information about scope of appointment and such in the packets that you guys received or were emailed. Please take a look at it just so that you are aware of some of those do's and don'ts. And again, please, if you think you've witnessed something, experienced something, or are just not sure, call us and we'll help walk you through it to see if it's something to worry about. If it is, we'll help you report it anonymously if necessary. And if it's not, we'll let you know, but still appreciate the fact that you questioned it. All right. So if you're looking at a Medicare Advantage plan as the option or the direction you want to go in with your original Medicare, a couple of questions you might want to ask yourself before you make that leap. If the Advantage plan comes with prescription coverage, please make sure it covers your specific prescriptions. And we'll talk about this in much more detail next week. Every prescription plan through Medicare, whether it's included as a part of an Advantage plan or whether you purchase it as a separate standalone Part D drug plan, every plan available, and there are over 20 of them in Colorado, has a different list of drugs they cover. You want to make sure that your drugs are on whatever list for whatever plan you enroll in. If you have providers or doctors that you want to keep, you might want to ask those providers if they accept whatever plan or plans you might be looking at. If you enroll in an Advantage plan that your providers do not participate with, you would no longer be able to see those providers unless you're willing to pay out of pocket. So you want to check with your providers, especially if you want to keep any of them. This is not as such a big deal as it used to be a couple of years ago, but I know specifically here in Colorado Springs, we have 2 primary hospital networks. Some people have very strong opinions about one hospital network over the other. Most plans will now participate with whatever hospital network is available in whatever county they're in. So it's less of a concern, but might still be something that you ask about. If you have pre-existing health issues or develop health issues and you see a lot of specialists, you might want to take that in consideration because, again, remember, if you are in an HMO and you need to see a specialist, you may be required to get a referral from your primary doctor every time you need to make an appointment with a specialist. So you'd be looking at having 2 appointments to see that specialist and potentially 2 copays for that. If you're looking at the extra benefits, and I know a lot of people and the marketing is really focused on these extra benefits, specifically dental coverage and any of these other more flexible options, such as transportation options. Some of them have meal delivery after a hospital stay. Some of them have free gym memberships. You know, all of those extra benefits. Dental is usually at the top of the list. Ask how those benefits are accessed with each plan that you are considering. Every plan is going to require you follow their rules in order to use benefits such as dental. A lot of people get into these plans and think that they can just use that insurance at their dentist. That's not usually how it works. The plan either has their own network of dentists they require you use, or they may have a bigger list, but still a more limited list of dentists versus you just being able to go where you want to go. So be sure to ask questions on how to access those extra benefits that might be catching your attention. Again, here's the front cover of that handout that I explained, goes into more detail about the differences with these plans. Also, I have been able to, for my 3 primary counties here, El Paso, Park, and Teller, I've put together an at-a-glance kind of handout. This handout that was included in your packet or email lists all the Advantage plans available in Park County or Teller County or El Paso County. It's going to list all the plans out there. It's going to give you some basic costs. It's going to tell you what kind of plan it is, HMO versus PPO. It's going to tell you whether or not that plan has a premium. It's going to tell you whether or not that plan has deductibles that you would have to worry about paying. It's going to give you an idea of what the copays are going to be for most common services, such as office visits, hospitalizations, that kind of thing. With Advantage plans, keep in mind, you pay little or no monthly premium for this kind of coverage, but in exchange for that, you will pay copays for most services. For example, if you have a hospitalization, you're going to pay a daily copay with an Advantage plan. And as shown on this chart, that daily copay could range anywhere from $295 per day to $500 a day for the first 4 to 7 days of a hospital stay. So if you're there 1 day, you pay 1 day copay. If you're there 7 days, you pay that copay times 7. And you have to pay that because there is no insurance that will pay that for you. That's the exchange you make when you pay little or no monthly premium. Another benefit that was really big last year that you may have seen a commercial or 2 for was the Medicare Part B buyback. That was the newest fandangle benefit some of these plans were offering, where they would pay your Part B premium. Only a small handful of plans cover that in any given county in Colorado, and none of them pay the whole premium. Most of them will pay maybe $40 or $50 of that premium, and it's a reimbursement that goes directly to Social Security so that they simply take out that much less of your check. And I've tried to indicate that as well. So most of these plans do have a max out of pocket, meaning if you have a bad year and you're paying lots and lots of copays, there is a maximum amount that you would actually have to pay within a given year with that plan. And if you reach that maximum out of pocket before the end of a year, that plan would have to continue covering any services you needed for the rest of the year at 100% with no copays. But unfortunately, those out-of-pocket maxes tend to be so high that most people will never meet them. But they do actually have limits where original Medicare does not. All right. Any questions about any of that? Nothing? Nobody? Maybe I should start having a test at the end. I see a hand raised.
For Park County then.
Yes, go ahead.
That sheet. Hi. The sheet you were just showing, this one right here.
Mhm.
Yeah. Yes.
You have it. We have it just for Park County.
Oh, yeah.
And we get other ones.
No, I just wanted to know they weren't supposed to be here. Teller and whatever the other one was, El Paso.
Oh,
I also have one for Teller and El Paso, but you guys got the Park County one for obvious reasons.
Right.
Okay.
Right.
Yeah, that's what I.
Okay. No,
But I am
that's good. Thank
happy
you,
to
Roma.
send the other ones. But keep in mind, when you have an Advantage plan, you have to stay within your service area or county primarily.
Right.
So you're not usually going to be able to go out of your county for services.
Because there are no services.
Yeah, in Park County, there is no services as far as
And-
the, you know.
And unfortunately, when it comes to the more rural areas in any state, that is going to be the case. Obviously, you see there are lots and lots and lots of plans listed here. But as you say, there's not a whole lot of services out there. So it's buyer beware. Be aware of what you've got available. Even though there's all these options that people will be happy to enroll you in, does not mean that's going to do you any good.
Right.
And because you're limited to your service area, primarily, it could be detrimental to get into a plan like this where services are more limited.
Okay.
Yeah.
Is that good?
Yeah.
Thank you, Roma.
You're welcome. Any other questions, comments? All right. I know it's a lot to digest. We're almost done. All right. So the last thing we're going to talk about, and we covered this briefly last week, Medicare savings programs. Again, these are financial assistance programs specifically for people with Medicare that at the highest income level will at minimum pay your Medicare Part B premium so that amount is not deducted from Social Security. And at the lower income level will not only pay your Part B premium, but may act as a Medicare supplement and cover your Medicare deductibles and co-insurances for any and all services. Income and asset limits. These are gross monthly income amounts, pre-deduction monthly amounts, and asset limits. If anybody has any questions or wants more information about these programs, please give us a call. We also help with these applications and are happy to talk to anybody who wants more information. Again, we have a sister program to the SHIP, which is called SMP, or Senior Medicare Patrol, which focuses primarily on information and education regarding fraud and abuse of Medicare and Medicaid. Again, if you see marketing violations, you see something that's questionable being done by a sales representative, agent, or broker, say something. Give us a call. This is what we're here for. This is what we will help you with. If it turns out to be nothing, great. If it turns out to be something and you don't say anything or you don't question that, unfortunately, insurance tends to continue to get away with doing things they shouldn't do. And ultimately, it hurts somebody somewhere, somehow, whether by getting enrolled in something they shouldn't have or what have you. So please, if you ever come across anything you're not sure of or is questionable, you can call the Colorado State Hotline, the 1-800 number, or you're always welcome to call us. And that is it. That is all I have for you guys. And I will stick around for a few more minutes to see if there are any last minute questions, comments, or concerns. Here's our contact information. I do currently have a total of 5 full-time counselors, a couple of part-time volunteers, and another volunteer hopefully coming on board here soon. So someone should always be available to reach back out to you if you give us a call. You may not get someone live, but we will call you back as quick as we can. Again, I've included our Colorado Springs number as well as the statewide toll-free number. If you have questions that you can email, shoot me an email at seniorinsurance@ppacg.org. Those come directly to me. Those are honestly always the best way to contact me and get a quick response. And if anybody is crazy enough to be interested in any volunteer opportunities that we might have, I'm always happy to talk to you about that as well. And with that, I will shut up and let you guys ask questions if you have any. You guys are awfully quiet.
We're saying it's a lot here in Bailey and that we probably have to digest a little bit.
It is. And this is breaking it down into 4 parts. I used to do all of this in 2 hours. So.
Oh my goodness. Yeah.
So you guys are, I'm being
quite
nice.
a lot.
It is. But again, we are always available if you want to call us or if you want to shoot me an email. If you have questions after you've digested some of this, happy to answer those questions after the fact as well.
Great. You are an amazing presenter and you make it so much easier to understand. Thank you so much.
You're most welcome. Happy to do it. All right. Well, if there's no other questions, then I will let you all go and hope to see you next week when we talk about Part D. We're going to go into deep detail about how that works and what's covered and what it costs. And then if you hang out for the 4th week, we're going to talk about all other types of insurance that coordinate with Medicare. But Part D, very important, and a lot of good information next week.